Good morning, everybody. Really lively music to get you started, so I hope that you enjoyed that and enjoyed our opening presentation there. Just a lot of really important information we wanted to share with you right off the bat before we got started. So again, welcome. We're very excited to have you. This is the 2023 Wisconsin Enrollment Conference. I'm Allison Espeseth. I'm the Director of Covering Wisconsin. We have been hosting this conference for 10 years now, and it is with the dedicated support of the Wisconsin Office of Commissioner of Insurance and the Wisconsin Department of Health Services. It's with them that we make it possible for individuals like yourself to get the education and credits needed to serve as enrollment assisters. I want to thank the sponsors for this event, of whom you saw their logos this morning, but I'll just name them. Anthem Blue Cross Blue Shield of Wisconsin, Common Ground Healthcare Cooperative, Molina Healthcare, United Healthcare Community Health Plan, United Way of Dane County, UW Health Unity Point Health Meritor Courts, Group Health Cooperative of South Central Wisconsin, Network Health, Chorus Community Health Plans, Group Health Cooperative of Eau Claire, Security Health Plan, and Wisconsin SMP. We so appreciate their support. I'd also like to acknowledge Covering Wisconsin's funding from the Federal Centers for Medicare and Medicaid Services, which is instrumental in allowing us to continue to bring forward this program. It's through CMS that each year since 2014, Covering Wisconsin has successfully been designated the Health Insurance Navigator grantee for our state. These funds, in combination with those from the state of Wisconsin, have allow us this year to support 45 individuals around the state to serve as navigators. These navigators serve consumers in all 72 counties, and we're so pleased to have them. If you are new to our services, or even if you're familiar with our work, I want to make sure you're aware of some of the ways in which we can support your work. So this includes, most importantly, I think, for so many of you, the outreach and educational materials that we provide. These include our how-to sheets that many of you are familiar with that educate both consumers and professionals about options that are available, how to use coverage, how to pay for coverage, what to do when you lose coverage. And these are all available on our website, which is coveringwi.org. We also have, we have these resources in English and Spanish, and they really cover a variety of messages and formats, especially the outreach materials that include messages both for the ongoing unwinding as well as the upcoming open enrollment. Both of these are included in these resources, so we really do encourage you to take a look. Even if you've been there before, take a new look. We are constantly putting up new resources, new messages, especially as we monitor kind of the trends of what's going on in unwinding and what we see in trends in insurance in general, thinking about new communities and audiences that we need to reach and how to reach them. We also host the Connector tool, which is an online tool where the public can find you and your availability to help with enrollment. So we know we asked about that in the registration. Thank you so much for checking that, making sure you're listed if you do provide enrollment assistance. And for those of you that want to be listed, we have identified you, and we will be including that information and reaching out if we need more information. And of course, we also provide and host presentations, trainings, and this annual conference. And as you very likely know, this conference allows you to earn your state of Wisconsin required pre-licensing and continuing education credits. Just a few reminders on all of that, especially if this is new for you. You need to be sure to attend all the sessions, the full sessions, in order to qualify for those credits. And after the last day of the conference, Covering Wisconsin will be sending out those certificates of the earned credits. We prioritize those who are in pre-licensing since they need to do the licensing exam. And then we will follow up with all those who are getting the continuing education credits. Let us know if your name that you use to log into this platform might be different than what you would be using or what is in the system with OCI. Sometimes that kind of discrepancy can lead to some challenges in just making sure you get the certification that you need. So thank you again for being a part of this community and welcome. I want to also note, you may have seen in the emails that we sent out, there are also virtual exhibit booths this year. So please do check those out. There was one this morning, and it'll be every morning of the conference, 8:15 to 8:45. When you go into the platform, you will just click on the link and be entered into that virtual exhibit booth. There will be representatives of sponsors that are making those available, and you can chat with them, ask questions, and see what kind of services they provide. And a few logistical notes before we get started. We're really pleased to be working with the Wisconsin Union Conference Management Services this year. You notice it's a different platform, so wonderful that all of you made it, and hopefully you don't have any technical issues, but if you do, there is help available for that. You will just look in the top right corner of your screen. There is live help. You can click on that button for any technical issues that you might have. If you have questions, we strongly encourage questions for our presenters and our speakers. We love that kind of engagement. We will have poll questions throughout that we encourage you to participate in. And if you have questions, you'll notice that the chat is disabled, but there is a Q&A feature, and that allows us to much more easily monitor your questions and make sure that we're answering them as best as we can. So please do use that. And because your video and your mic are muted, again, that Q&A is really how you will be able to engage with presenters. And then if you, beyond just using the live help button, if for some reason you need to use email to communicate any technical questions, there is the conferences@union.wisc.edu email address that you can also get in touch with the technical assistance. All of these sessions will be recorded, and we will be making slides available after presentations. They will be on our conference, the Covering Wisconsin Conference webpage, and you can find them there if you wanted to look at them afterwards. Starting tomorrow morning, I will be announcing gift card recipients, both for those who submitted photos during registration as well as those who are attending sessions. So look forward to that. Keep an ear out for your name being announced. Excited to share that once again this year. And then finally, before we get started, there will be a special opportunity. This was listed in the presentation at the start. At the end of the conference, a post-conference opportunity on Friday, September 22nd, 1 to 2 p.m. As a general Q&A. We often find people have questions after the conference, whether you're preparing for the exam or just want to make sure you fully understand policy, processes. That will be, like I said, 1 to 2 p.m. Friday, September 22nd. And there is a link on the conference, on the Covering Wisconsin Conference webpage that you can get access to that. You don't need to register. You can just click on the link. And with that, I am so pleased to introduce the moderator of our opening plenary session for this 2023 conference. Jennifer Sullivan is Director of Health Coverage Access at the Center for Budget and Policy Priorities, where she also leads the Beyond the Basics project, which provides training and resources about the Affordable Care Act's marketplace and other health coverage programs to support navigators and others who help people get and keep their health coverage. Previously, she was Director of Policy and Programs at the Alliance for Health Policy, has served in leadership roles at Enroll America, held positions at the Center for Medicare and Medicaid Services and Families USA, where she worked on federal policies to strengthen health coverage programs for low-income people. Sullivan holds a Master of Health Science and Health Policy from the Johns Hopkins Bloomberg School of Public Health and a BA in Sociology from Kalamazoo College. Thank you so much, Jennifer Sullivan, for moderating today, and I will gladly hand the session over to you.
Great. Good morning, everybody. And thank you so much, Allison and Covering Wisconsin, for inviting me back to moderate this morning's plenary. What's not in my bio, but I'll share with all of you, is that for about 7 years in Virginia, where I live, I volunteered on the weekends during open enrollment as a certified application counselor. So I know a little bit about what your day-to-day looks like during the open enrollment period. And I just have so much respect for everything that enrollment assisters do. I love this time of year. The energy is building leading up to the start of open enrollment. And if you've been counting open enrollment periods like OE1, OE2, OE3, etc., you might be tempted to call this upcoming one OE11. But over at the Beyond the Basics project that I lead, we've been referring to this as the 10th anniversary of marketplace coverage, because 10 years ago, in October of 2013, the first marketplace open enrollment period started. So I want to start out this morning by offering my gratitude to all of you for being part of this important work, and especially to those of you who have been doing it since the very beginning. You clearly care deeply about the communities you serve, and they're incredibly fortunate to have you. You also have grit. The only constant in the marketplace is change. And if you've been doing this more than a few years, then you have seen a lot of change, from website malfunctions to call center snafus, a navigator funding roller coaster, years when we were worried about whether enough plans would participate, and years where there was choice overload. And speaking of loads, you've seen silver loading and moments when we weren't sure whether the ACA as we knew it would even continue. You've probably learned what SCOTUS blog is, and that the NBPP, the payment notice, and the annual marketplace rule are all terms that refer to the exact same thing. And in the spirit of no good deed goes unpunished, now you're on the front lines of Medicaid unwinding. But most importantly, over the last few years, or maybe even over the past decade, you have helped a lot of people navigate the labyrinth that is enrollment and help them get health coverage that brings greater financial stability and sometimes life-saving care. You have truly done heroic work, and you should feel very proud. If we were in a conference hall or an auditorium in person together right now, I would pause and make everybody give one another a big round of applause. But these times being what they are, we will move on with the start of this session. And I know you're going to learn a lot from our wonderful speakers today, and I know you'll have some great questions for them as well. So be sure to pop those in as they occur to you. So we're fortunate to have with us today Jory Mundi, Bureau Director of Eligibility and Enrollment Policy in the Division of Medicaid Services at the State Department of Health Services, and Rachel Cisney-Carabel, the Deputy Commissioner of Insurance at OCI. I'll introduce each speaker, and then she will provide brief opening remarks. And after that, we'll have a poll question and then move into our discussion. And there should be time at the end for several of your questions. So again, be sure to enter those. Now I'm going to go ahead and introduce our first speaker, but I'll introduce both before Jory starts her opening remarks. But Jory Mundi oversees the development and implementation of healthcare and SNAP policies in the state of Wisconsin. She's worked in the human services sphere for over a decade, spanning Medicaid and SNAP eligibility policy, human services systems, and pharmacy Medicaid in Indiana, Texas, and now Wisconsin. She earned her master's degree in public affairs in 2015 from Indiana University. She's a 2019 graduate of the prestigious National Leadership America program and a past board member helping foster women into becoming executives. This past spring, she was named one of Madison's In Business Magazine's 40 Under 40 recipients, And she's a dedicated public servant, whose focus has been to help better the lives of the individuals she serves. We'll also be talking with Rachel Cisney-Carabell this morning. Rachel is responsible for the overall operations of OCI and actively participates in the National Association of Insurance Commissioner activities and engagement with stakeholders. She is a member of the state's Group Insurance Board and the Governor's Birth to 3 Interagency Coordinating Council. She is an experienced health insurance and employee benefits expert who has held leadership roles in both the public and private sectors throughout her career. She brings more than 20 years of experience to OCI, and she's a graduate of the University of Wisconsin-Madison. With that, I'm going to turn it over to Jory to get us started with her opening remarks.
Thank you so much, Jennifer, and good morning, everyone. It is truly a pleasure to be with you all this morning. And I look forward to really talking about all of the work that Wisconsin's Division of Medicaid Services has been doing, specifically regarding unwinding, and also talking about what lies ahead as we look into the next year. So almost as soon as continuous coverage was enacted in Wisconsin for the pandemic, our teams really started thinking about what we were going to need to do essentially when it ended. And that said, I don't think any of us expected that it would be 3 years that the policy would be in place. And still we knew that it was going to be a challenge, and as big of a challenge as it has been, and it has been, we've also seen it as an opportunity. So we've seen it as an opportunity to really look at our processes, to look at our systems, our communications, and to think about the changes, as well as the additions and improvements that we could make, not just for unwinding, but just as we also look towards the future. And so as I thought about just talking to everyone today, it came to me that there are 3 key things that we've approached unwinding with a focus on. And those 3 things are: 1, flexibility; 2, innovation; and 3, collaboration. So of course, it's a question that we've needed to be extremely flexible as we've worked with our federal partners to implement changes to our processes, whether they've been recommended and or required. And we have also innovated changes to our systems. A good example of this is we implemented an address change pop-up to our Access website, as well as our My Access mobile application. And so it really provides a simple notification, but a critical reminder for our programs, specifically for our members, to be able to update their contact information so that we can reach them. And last but not least, we have also done a lot of collaboration. We essentially are keenly aware that our work relies heavily on the partners, you all in the audience, and your work out in the communities, amongst our state. And so engaging our members, sharing information, and providing assistance. And of course, our shared goal is to keep the people of Wisconsin covered by health insurance, whether it's through one of our programs, through coverage through an employer, or through individual insurance, like the plans available through the marketplace at healthcare.gov. And so I'll talk more about these themes, about flexibility, innovation, collaboration throughout the course of the session. But for now, I'll turn it back over to you, Jennifer, to get to the questions.
Sure, wonderful. Thank you so much, Jory. And I'm going to actually turn it over to Rachel first to give her opening remarks.
First, I just want to say thank you to Allison for inviting me to be here to take part in this plenary session. Looking forward to the discussion with Jennifer and Jory. I too feeling a lot of excitement building towards open enrollment. And I must say, Jennifer, your comments really resonated with me, talking about kind of the ups and downs and lessons learned and experience of the last 10 years. So there's no trauma or flashbacks involved whatsoever. I do look back though, and like I said, can resonate with lots of different feelings from all of those ups and downs. And I'm happy to be here to share, what I can, information about kind of what we're doing to support open enrollment, what we're doing to support the Department of Health Services through the Unwinding, and to try to make sure that we have all hands on deck as far as the Unwinding goes. But before we get into any questions, I just want to share a little bit about what OCI does. I know we tend to be kind of we're not on the forefront as far as a lot of folks' experiences are. So just a little bit of a summary of what we do. One of our primary functions is to monitor financial solvency of insurers to make sure that they have the resources to meet the commitments that they make to pay claims, whether that's health insurance or homeowners or auto or whatnot. We also make sure that insurance policies comply with Wisconsin laws and statutes, and we issue licenses to agents, to insurers, and to pharmacy benefit managers as well. We also monitor those entities' behavior in the marketplace to make sure they're complying with state insurance laws. And one aspect of this is that we do monitor marketing practices. We do have a separate session where there's some folks from our team, our consumer affairs team, that are going to talk about some of the insurance scams that are out there. Unfortunately, when there's a big change in the marketplace, it does present an opportunity for some folks to perhaps take advantage of people that are vulnerable. So we want to make sure that all of you are well informed and are keeping an eye out for some of those scams and can help the folks you're working with to avoid getting caught up in some of those scams. So please go pay attention or listen when Amy and Shelley are presenting later, because I've got a lot of really good information for you. We also do a lot of work assisting and educating consumers. Some of that is just when they call us because they have questions. We certainly do a lot of education, but we have a fabulous team that does a lot of work developing toolkits, developing social media posts. We promote that as much as we can, and we get other entities, other partners we work with to help educate consumers about insurance, not just that it's available, but also to how to prepare and make the most out of their insurance benefits. So they do a great job. Please check us out on social media. Use our information because we put a lot of effort into it, and I think that we've got some really good stuff out there. Specific to the individual market this year, we do have 15 insurers that are offering coverage in the individual market. 13 of those will be offering their plans on the exchanges. We do expect that there are going to be perhaps some insurer changes, maybe some changes to service areas for 2024. Unfortunately, at this time, we can't really announce any specific changes. We don't do that until the agreements are signed and the insurers have actually committed to participate in meeting the program requirements, and signatures on those agreements are happening now. So we expect the final details of the service areas and who's participating to be available in early October. We continue to be a partner and a resource for all of you. We work very closely with Covering Wisconsin and the Department of Health Services to make sure that through use of data and outreach, education, communications, we're partnering together to be a resource for folks that are looking for coverage options. I would also, if you haven't heard already, let everybody know that we have, and we're very pleased to have this project completed, but we've automated the certified application counselor process, so the registration process. So that is now available automated. And also we have created a public-facing search tool for application counselors. So check out our Navigator license page, and I believe that that you should be able to find that resource, that lookup tool there. So we're very happy to have those resources available for folks. And with that, I'll turn it back to you, Jennifer, and I look forward to today's discussion.
Okay, great. Thanks, Rachel. At this point, we are going to have our first of two poll questions. So can I ask my colleagues on the technical side to go ahead and start that first poll question? Okay, so to get you thinking about unwinding, what do you think is the biggest challenge related to unwinding from where you sit? Looks like the clear early favorite is getting people to respond to paperwork and information requests. Some other options include helping people who've lost Badger Care for administrative reasons, helping people transition to marketplace coverage, helping people transition to employer-based coverage, or something else. I'm curious what the something else is. It looks like right now we've got a strong majority who say it's getting those information requests responded to so that people don't end up being terminated for administrative reasons. Okay. So I think we'll go ahead and pull those down and bring our speakers back into view, but thank you for engaging in the poll, folks. It's just always good to know you're paying attention, and we value your actual answers too. So this first question I have is mainly for Jory, and you've given us kind of the landscape, but tell us right now, it's the middle of September, where is the state in the Medicaid unwinding process? And sort of, can you project a little bit of the future? What's the roadmap for the next little while?
Sure. Thanks for that question. Yeah, so we are in September, which puts us in the 4th month of the unwinding process. And so we know that there are more than 130,000 members who have successfully renewed their coverage across our programs. And that's since the process began this past June. Now, of course, that's a rough figure because every moment of almost every day, people are handing in renewals, they're submitting documentation, and our partners at the local level are also making determinations. So the numbers are constantly changing. But people can really essentially see our progress in terms of the unwinding process here in our state by looking at our renewal data dashboard. And that's on the DHS website. We update the information shown there every 3rd Thursday of every month. So keep an eye out for next week. And of course, because the information is updated once a month, what's there is essentially a snapshot in time. But it helps people to get a sense of our overall numbers and kind of where we stand. And we're also not just adding data for each additional month. We're also updating the figures from past months. So a good example is when we first reported about our June renewals back in July, we were just short of around 30,000 renewals where people kept their coverage. And essentially a month later, that number was just at short of 40,000. And so that shift essentially reflects agencies completing determinations after getting documentation and additional information from members or members doing what's called a late renewal. And so what pattern we're seeing, of course, is that unwinding is dynamic and it's an ongoing process. And one of the charts, specifically as it relates to the data dashboard that people can see, shows where our enrollment level was back in 2019, as well as early 2020. And so it looks like a straight line at around maybe 1.2 million people. And there was a change happening. So it was just that the number of people who began participating in our coverage in any given month was roughly similar as the people who left our programs. So it essentially looks level for the most part. However, when continuous coverage kicked in, when that provision started, back in March of 2020, the chart changes. So you can see a sustained increase in enrollment because no one was essentially leaving our programs. So every new member was essentially an additive to those numbers. And so as we return to routine operations, we expect that eventually our chart will look more like it did back in 2019, not necessarily at the same enrollment figure per se, since that is really dictated by whether or not members are eligible, but in terms of leveling out, at a lower figure. So this is important to remember, when we're watching figures around disenrollments in particular, because our programs gained nearly 500,000 people during the continuous coverage period. And we know that there will be an adjustment to that. We're definitely not making any assumptions about how large that adjustment is going to be. However, as I first mentioned, our goal is to keep Wisconsinites covered. So across the remaining period of Unwind, I think you'll continue to see us build on the strong foundation that we laid in terms of meeting and collaborating with partners, going back to 2022 and even earlier this year. And also, if Wisconsinites are eligible for coverage through a state program, we want to make sure that they have that coverage. And so it's really the reason why we've been so active in preparing for this period, preparing for communications through a variety of media to reach members, as well as collaborating with the partners, specifically in this audience, to really get the word out. And it's why we continue to watch our processes and systems to see where we can make improvements, and also use some of the flexibility to innovate those changes, so that we can make things more efficient to essentially reaching that goal.
Thanks, Jory. Follow-up question there. A year ago, we all knew this was coming, but no one had any idea what it was going to look like. This is obviously unprecedented in every state in the country. I'm just wondering if you can share, at this point in the process, what are you learning? Are there adjustments you didn't expect to make that you're making, or things you're learning about the enrollment process and how enrollees engage with it? The renewal process, I should say.
Yeah, so great question. I think this is an unprecedented event. And so we essentially planned for the run of the gamut. I don't know that we have seen anything in particular that we didn't anticipate because we were planning for the unplanned. I think it's, in terms of leveraging the collaboration and messaging with our partners here in the audience to be able to reach as many members to get information so that we can make those determinations has really been, I would say a real success for us, because of, that time that's passed from the onset of the pandemic, and, keeping as many individuals covered. And as a part of that, being able to reach people so that we can get the information that's needed in order to make those determinations. And so, I think with that, as I mentioned before, just really engaging with partners and collaborating and messaging and doing everything that we can to make sure that members, know that the continuous coverage provision, when that came to an end, as a part of that, and then also planning so that the transition of coverage, whatever that looks like, can be as smooth as possible. So I think we planned for unplanned, and have just been able to leverage, being flexible, integrating where we can, being innovative, and leaning on our partners to be able to really, leverage those channels to reach our members to make changes there, and to get information needed so that we can make accurate determinations.
Got it. I'm going to shift now to you, Rachel. Obviously, you have a different vantage point when it comes to unwinding, but you do in your role hear more directly from health plans, who of course are also intimately involved in all of this. And what happens over at Medicaid has ripple effects on the marketplace and an individual market. So what are you hearing from health plans about unwinding so far?
Sure, and we certainly do recognize that much of the burden falls on, the Department of Health Services, and they, with regard to the unwinding and the renewals and whatnot. Our approach has always been to be here and be as helpful as we can as one of those partners, sharing data, helping get the word out, getting agents, navigators, assistant application counselors engaged and aware and prepared for this moment, and agree that the department is doing an incredible job with being flexible and innovative and addressing issues, and as more and more information comes available. I also would say the health plans have been in a similar role, right? They've been at the table, they've wanted to be present, be as well prepared as they can, and we all have an interest in making sure that people don't fall through the gaps, or have a gap in coverage and fall through the cracks, if you will. And so that has been our primary goal. What we have heard so far is, one, it's still very early, right? There's a certain timeline when people find out about their renewal, and if they are losing their Medicaid coverage, there may be a gap in time before they actually get enrolled in other coverage. So it's still very early for the health plans as far as actual numbers and enrollments may be happening. But what we are hearing is consistently that call volume is up pretty significantly at health plans. It doesn't seem like it's anything that they can't handle. They seem to be doing a good job keeping up with the demand, but certainly call volume is something that they are experiencing right now. And I believe Covering Wisconsin is in a similar situation, receiving lots of different calls from folks trying to understand what their options are. So we're definitely keeping an eye out for the impact to insurers, as more and more people end up entering the marketplace. There's a lot of different estimates out there about where people are going to land. We do expect, many of them will end up getting employer-based coverage, but we do know many of them will end up looking for coverage or need coverage through the individual market. And so we're going to keep an eye out for that and making sure that insurers are prepared and responsive, and that it doesn't affect enrollment or even processing of claims and whatnot. But at this point, it seems like things are under control.
Got it. So another follow-up question for you, Rachel. I know that your department has done some work to look at the impact of short-term limited duration plans. And I'm wondering if, one, you can tell our audience what that means. What are these plans and how are they different from the plans that they may be most familiar with as enrollment assisters? But what does that mean for the overall sort of state of the private insurance market in Wisconsin?
Sure. So short-term limited duration plans are, they're unique in the sense that obviously they're short-term duration. The state law limits the amount of time that they can be available to individuals, anywhere from 3 months up to 12 months in coverage, and then they can be renewed for up to a total of 18 months. By definition, they're not required to provide all of the same coverages and benefits that an ACA compliant plan would. For example, there are certain essential health benefits that they may not be required to cover. Again, they're limited in how often they're available. They do tend to be on the lower end of the premium because they may not cover all of the services that maybe a more comprehensive plan might cover. We did do some work as a result of a federal grant that we got. We did a study, and this report is available on our website. The grant actually funded a number of different activities. The first one was looking at the individual market, in particular, trying to understand what consumers are buying, and what are they paying for individual coverage, where are there gaps in coverage. And then the second report was specifically looking at these short-term limited duration plans. And what we were really trying to understand is, how many people were enrolled and what kind of impact were they having on the overall individual market. So that is out there. What we've generally found is that they are, well, actually, first, let me talk about the overall, that first report that I mentioned about the individual market. So we did learn that, and we used the information that we learned about different populations and where they maybe are not getting the comprehensive coverage that they could. So we identified 4 different population groups as part of that report. The first one was that we found that there are a lot of underinsured individuals between the ages of 54 and 64. A lot of these folks were buying bronze plans, for example, at a higher rate than maybe a silver plan was available. So they were paying more for less coverage. So that was one group that we identified. Underinsured men, ages 18 to 34, perhaps not a surprise to many of us, that they were more likely to report that they didn't need health insurance or that they didn't want it. We also identified that there were a lot of uninsured in rural areas that had never heard of healthcare.gov or knew that tax subsidies might not be available or might be available to lower their premiums. And then we identified that there are a lot of uninsured Latinos in the Milwaukee area in particular that had not heard about healthcare.gov or didn't know that it was available to them. So we've used the results from that study to in our marketing campaigns that we did prior to open enrollment, and we'll continue to focus on those groups going forward. What we did find about the short-term limited duration plans in particular is that while there are quite a few insurers that are offering these plans, there's 12 insurers that offer them in Wisconsin, they don't have a significant number of enrollees. We found just over about 10,000 enrollees that are enrolled in this plan, and that's a decrease from the prior year. We also found that a lot of the consumers buying these products are between the ages of 55 and 65. So again, it's, you know, that same group that we found in the first individual market report that, you know, is paying for higher costs, but less comprehensive coverage. So they do represent about 25% of the people that are buying these plans. One of the areas that's of concern, especially if people don't realize this, is that a lot of these plans do limit their mental health and substance abuse coverage. None of them cover maternity care. You know, so that's really important for people to understand if they're looking at these plans. We also saw that many of them had a much higher claims denial than our more comprehensive plans. And some of that may be driven by the fact that they're not as comprehensive in their coverage. And then what we found, and that what we're concerned about, as I mentioned before, we do have oversight over marketing practices, is we did find some language that these plans might be using that is suggesting that these are, you know, alternatives to ACA coverage. Maybe, you know, they provide freedom of choice, for example, or for others who don't lack adequate insurance coverage. So while they're not a big player in the individual market right now in terms of enrollment, we are concerned that people that maybe lose their Medicaid coverage could be susceptible to enrolling in these plans when maybe they're not in their best interest, you know, if they need more comprehensive coverage, and making sure that they understand that very affordable coverage might be available on healthcare.gov, but might provide, you know, more comprehensive coverage. So, you know, that's what we've learned. And again, it's, you know, we want to make sure that people understand and they get the best coverage that they can for a price that's affordable. And so we just want to make sure people are aware of that.
It's great. It's always a little bit scary to hear about these plans and that people might not understand that they aren't enrolling in Obamacare, that maybe they think they are and they're being misled, which is not always the case, but sometimes, and particularly in this moment when so many people are transitioning between coverage. It's great that you're keeping an eye on this and making sure that even that this audience understands that these plans are out there, and that if people start talking about a plan that looks and sounds like this, it probably is, and can we let that person know about what's available in the marketplace instead?
Yeah, and Jennifer, and it's so important that people do get connected with credible sources like the enrollment assisters on this call to make sure that they do understand those options. So again, the valuable resource that this group provides to make sure people are getting to the right coverage is so critical in our marketplace.
Definitely. Well, my next question is really for both of you. You've both talked a little bit about how Unwinding looks from where you sit. But what can our audience do to be in service of this shared mission? Do you have specific advice for how they can help you out? and what messages or information do you want to make sure that they're sharing? And I think we've been talking about some really broad ones for months and months, but are there specific things in this moment that you want to make sure that your avid messengers out here are conveying to the communities they serve?
I can go first, if that's okay, Jory. So one thing that, from our perspective, it would be really helpful if our audience, when you're talking to folks, make sure to explain the difference between Medicaid and commercial insurance. There are significant differences, and if people have only known Medicaid, there might be some things that are a surprise. And in particular, cost sharing, for example. Explaining what a deductible is and copays, maximum out of pocket. How many people, even that have insurance today, understand what those terms mean. The use of networks, right? Making sure that people are using in-network providers. These are important things because the consequences of not understanding that and not maybe using a provider that costs a lot more out of pocket can be a real surprise to people. So we want to make sure that people are as informed about how to maximize their benefits as possible. And, you all are on the front lines of communicating with staff. So that would be one thing that would be great to make sure people are protected and understand. We do also have a resource available on our website that might be helpful to all of you to take a look at. It provides an incredible amount of information. It was based on a session that we held for navigators, assisters, agents back in June, I think it was. And I think, Jory, maybe you participated in that. I think we had DHS present, we had the Board on Aging and Long-Term Care present, in particular for folks that may be Medicare eligible, and then of course Covering Wisconsin presented as well. And there's a lot of and of course our team did. So that if you didn't participate, we had something like 400 some people participated. If you did, those resources, the slides, whatnot, are available on our website. And if you didn't, refer to those, because there's a lot of really good information that will help you, in communicating with folks. And then the last thing that I would say, if this is possible, if as you're talking with folks, the same issues come up over and over again, if there's a way to collect that and give us that feedback so we can take a look and see if there's something that we can do to address any barriers, that feedback loop would be really, really helpful. So if there's a way, again, the same kind of issue, the same kind of barrier you're seeing over and over again, that would be great information to funnel back to us.
How about you, Jory?
Yeah.
You're really in the trenches with this issue. So what can we do to help?
Absolutely. And I mean, obviously, you all are critical to this process. And we know how much of a difference that just your help is and how much it can make and help our members. Let me tell two quick stories. So when we started preparing for Unwinding at the end of 2021, we decided to put together a task force with a range of stakeholders and partner organizations and meet essentially on a monthly basis. And it gave us an opportunity to not only share what was happening at the state level out in terms of preparing, but also to get invaluable feedback, based on what people were hearing, and that's coming out of communities across the state. And as many of you may remember, while we waited to hear the definite, information on when the public health emergency and continuous coverage would sunset, we essentially focused our communications efforts in two areas. And one being updating information regarding an address, and also to sign up for an access account. And specifically, we also wanted to remind members to really focus on updating the contact information and their addresses because it was such foundational, because return mail has always been a really significant factor in churn. And so we created a pop-up reminder in Access and specifically our My Access mobile application, so that it would grab people's attention in terms of updating that address as soon as they logged in. And then we also created a communications campaign, supporting like a large range of different materials, from like flyers to outreach cards to different web pages, social media. And so really all focused on reminding people to update their addresses. And we put that information in a partner toolkit on our DHS website. And we invited our partners, so you all, to use them. And you did. And because you did, we're seeing unprecedented low rates of return mail, as well as mismatch addresses. And that's in single digits. And so this has, really greatly reduced the number of people who will miss renewing because of not getting their packet in the mail. And another area where we saw significant success was in the creation of access accounts. As I mentioned, we had supplied outreach materials and made them available. And the result, before we started the campaign back in 2022, and we had just short of maybe 330,000 active accounts for households, just as a part of our programs. And as we look 1 year later, back in February, this past February, after promoting these tools with the members, that number climbed to 670,000 active accounts. So that's more than double. And so, to say all that, your outreach has really made a huge difference. And we believe that the progress that we made in both of those areas with updating addresses to continue to, really benefit our members throughout the rest of the unwinding process. And so I wanted to just share those stories because we definitely feel like those are successes. But getting back to what can you all do to help? And I would say, to continue the work on the two topics that I just mentioned on updating addresses and also leveraging our access accounts. There's a lot of things that people have to think about, specifically with addresses when they move. Sadly to say, Wisconsin Medicaid might not be the first top of mind, but it is very much important. So just helping to remind individuals to keep their contact information up to date. And if they can, add an email or a mobile phone number to their accounts so that we have that information, because we've also started using text messages and emails to communicate important information to our members. And because phone numbers and emails aren't linked to a physical address location, these are different modes of communication channels that help to really reach people where they are. And of course, as I mentioned a little bit earlier, just access and My Access have never been more important than now. So right now, both our local and our tribal income maintenance agencies are dealing with, of course, unprecedented call volumes and workload. And for that reason, creating these accounts to use online tools to help members, complete their renewals, submit the documentation that they need, and find information about their benefits on their schedule, is crucial. And so, essentially every time a member is able to use Access or My Access, the mobile application related to their benefits, rather than calling into the call center, they are freeing up a phone line to help someone who may not have internet access, or who may not be, or just not able to use a smartphone or unable to use a smartphone, to call and get assistance. So I think that's another thing that we want to focus on. And then, and now that we're in the renewal period, we also need your help to help our members know when their renewal month is, and helping them to find that information in Access or My Access, so that they can plan ahead. So we have a page that's on our website where members can easily sign up to receive email reminders, and that's when their renewal window is open. And so just really reminding them to watch for their packet in the mail the month before the renewal, and to submit the renewal as soon as they can once they receive it, but for sure by mid-month, and by the mid-month date that's listed in the packet in particular, because this provides time, in this case for our local agencies, to follow up on any more information that's needed as a part of the eligibility determination. And, you know, if it turns out that they're no longer eligible, it also allows that time to start investigating different options, you know, for other coverage. So, so that's another note that I wanted to mention. And another thing is that our local agencies may reach out for more information. Another thing that would be helpful is, you know, helping members to understand, you know, the things that I just mentioned, and that after members submit their renewals, that which we're recommending that members do that through Access or My Access, that they should also watch their mailboxes in case there's, you know, a need for information, you know, verification that's being asked, to verify the information that they've submitted as a part of their packet. So it could be information like a pay stub, or identification documents, you know, some of those things that are needed to determine eligibility, so that, again, we can promptly get that information to process that, that renewal. And also, another good piece of information is that members can take photos with their phones, and submit the information through My Access, the mobile application. And so that may also help with furnishing some of that documentation a little easier than having to, you know, send a fax or drop off hard copies and things like that. So I think that's essentially the areas. A couple other things as I'm thinking is also to help kids in Wisconsin specifically stay covered. We know that there may be parents that may no longer be eligible, and who may think, hey, let's not bother to renew. However, there are situations that maybe where we don't realize, even if the parents may not be eligible because of an income increase, that their children may be actually eligible because of a higher income level. And so we appreciate your help in just, you know, to make sure to encourage parents to complete renewal so that the kids continue to keep and stay covered. And there are different materials that we have developed, you know, just about all of the things that I've just shared. And they're, as a part of what I mentioned earlier, the partner toolkit that's on the DHS website. So feel free to take a look at those things. Excuse me. And finally, I just want to mention that, as I was mentioning earlier, that you all play a vital role, you know, in helping people stay covered, and helping people to really understand their options, and if needed to quickly engage, you know, with the federal marketplace if they are no longer eligible under one of the state programs that we offer. So like finding new plans and understanding the different cost savings that are available. And all of those things can be really, really confusing. So being able to really lean into you guys in terms of your help with that to make, to help and give information to members so that they have the information that they need if they no longer qualify.
Thanks so much, Jory. It is absolutely fitting that you have a long list of things where you would love to solicit folks' help. And I know you have a good audience here who is going to take note and be working towards these goals out in the field. And I especially appreciate the nod to kids and helping to ensure that kids aren't losing Medicaid, even if their caregivers are no longer eligible. It's a critical point right now. Before we go to the next question, I just wanted to remind the audience that you have two just incredible state experts at your disposal today. So please submit your questions through the Q&A box on your screen. We will be ready to move to those relatively shortly. And this is your chance. What do you want to know? Please submit your questions. But my next question is, Rachel, for you. We spend a lot of time, or at least speaking from the I spend a lot of time thinking about transitions from Medicaid to marketplace coverage for people who are no longer eligible for Medicaid. But the data suggests that actually a large proportion of folks who are no longer eligible for Medicaid as part of the unwinding are very likely eligible for employer coverage. And that's maybe not an issue that has gotten as much attention, or at least potentially in policy circles and even among assisters. And I'm just wondering if you can tell us a little more about that. And even though assisters are mostly helping people connect to marketplace coverage, there are, of course, the questions on the application about affordability of employer coverage. And what if they're not eligible for the marketplace and they do have an employer offer? What options do they have, and what do assisters need to know about that?
Sure. Yes, I've seen the same data that suggests that a large number of folks that do end up losing coverage could be eligible for employer sponsored insurance. One of the big things that we've started hearing about, just anecdotally, is, concerns about employers not being aware that they are required to provide a special enrollment period into their plans if they lose Medicaid coverage. So they are required to do that. There is a letter to employers on CMS's website that has gone out reminding employers that they are required to have a special enrollment period for those folks throughout this duration, or regardless, but especially during this period of time when we've got so many people that could be losing their Medicaid coverage. So anything that the assisters can do to help remind people of that, if they're getting some pushback from their employers, that those employers are required to offer that enrollment opportunity. Again, employer-based insurance, same issue as individual coverage. In commercially based insurance looks a lot different than Medicaid. So making sure that individuals are prepared and are aware of some of those differences, like the cost sharing difference, the use of in-network benefits, et cetera, possibly paying premiums via their employer and whatnot. Regarding the affordability test that you mentioned, that there is an affordability test, meaning that if you're not eligible for healthcare.gov coverage if your cost share, your premium share is above a certain threshold. So, but if your employer's coverage is considered unaffordable, meaning it's above that, I think in 2024, it's around 8% or so of your income going towards that cost share, then you can be eligible for coverage and eligible for tax credits in the individual marketplace. So, not all employer coverage is going to be affordable for everybody. And so it's important to be aware of that and to ask for help if they can. Hopefully they're reaching out to assisters, but any messaging that they can, that you can do to make sure people are aware of that and help them understand because we don't want those premiums to be a burden for them. So that's really important for folks to keep in mind.
I happen to know, because we're in the middle of our annual big training series at Beyond the Basics, that the threshold for this year is 8.39%, or I should say for 2024, for employer coverage. And that's a lot lower. That's almost a percentage point lower than where we were last year. So there may be people who couldn't get marketplace coverage last year, couldn't get tax credits, who can this year, depending on how their income and their employer's premium requirements of them have shifted. So it's always worth another look. And I'm preaching to the choir. I know you all know that and are out there doing the outreach to encourage people to come back. But we're also in pretty early years of this so-called family glitch fix, where dependents can also qualify for the marketplace if the cost of dependent coverage through an employer exceeds that threshold. So maybe we didn't catch everybody last year, and it's time to get more of those folks back to the marketplace. I have one more question for you all. And I always ask a question like this. It's the think big, but if you could wave a magic wand and address one issue, not all the issues, and not like unwinding, that's not fair, Jory, you can't say that. But if you could fix one issue related to health coverage enrollment in Wisconsin, what would it be?
Go ahead,
Well, Jennifer, you took mine because I was getting ready to say. Yeah, so magic wands, they're short in supply these days, I'd say. But if we had one, I think we'd use it to make sure that everyone had healthcare coverage, full stop. I think that's, essentially, if we had the magic wand and had some limitations like working within kind of our current reality, then at least that would mean that, any Wisconsinite who was eligible to participate in our healthcare programs stayed covered. And anyone else who needs coverage had it through other options, whether it's employment, affordable plans, some of the other things that we've mentioned on the call. And of course, this isn't news to everyone in the audience. But not only is coverage good for people being covered, it improves access to care and supports, positive health outcomes, including an individual's sense of their own health and well-being. So it's also better for us, as a community and a society. And it encourages preventative care. Of course, which we all know lowers costs, it increases efficiencies, and produces better outcomes for our healthcare system. And it also reduces financial strain on our families and communities. And so, of course, we'll continue to use all of the non-magical tools at our disposal to reach that goal. But yeah, if we could wave the wand, it would be to make sure that everyone had healthcare coverage.
I'll allow that.
Yeah.
It's still pretty sweeping, but I'll allow it.
Well, and I'm afraid mine's pretty similar, to Jory's. I think, making sure everybody has access to the coverage that makes the most sense for them, right? That it's the best suited plan, has comprehensive coverage, covers, emergencies, it's affordable, meaning it can, doesn't put them in, financial harm. So that is certainly, my magic wand is to make sure that folks have that and that they're not, vulnerable to inappropriately persuasive sales tactics. Again, we're worried about people being vulnerable, right? They're losing coverage. The marketplace, it's a complex product to purchase, when we're talking about healthcare insurance. So making sure that people are well informed and that they're getting the coverage that they need and that it is not a financial stressor for them. So that would be my magic wand.
Thank you. Those are both beautiful visions to lead us into our Q&A now. Thanks for sharing those. We are actually going to pull in our second polling question right now, buy a little bit more time for folks to submit any other questions they have for our speakers today. But let's go ahead and let folks see that polling question, and we'll show the results in about a minute or so. The question, which I'll read for folks, is be a little self-reflective here. In what part of the enrollment process is a sister's help most needed? Would you say verifying identity, estimating income, submitting verification documents, comparing plans, or something else? I wish we could hear what the something else was. And we'll give folks a minute or so to respond to that, and then we'll pull the results up. All right, why don't we show the audience what the results are here? All right. Oh, verifying identity isn't a problem anymore. This is great. Or maybe not, maybe it is, but not the part that the assister can most help with. But interesting, comparing plans, still the area where you're spending a lot of time and resources. That is understandable. And I'm always curious what the other 2% is too. But thank you so much to everybody for responding to that and for staying with us this morning. So I do have a couple of questions from the audience. So Jory and Rachel, here we go with our first one. Let me see if I can get to the right point on my screen. Okay. So this person says they've been a navigator for the past 10 years, so they are seasoned, and they see a lot of adults who are not able to get good dental care that's affordably covered. Is anything being done to help with the limits and exclusions of dental coverage in the marketplace, and potentially increasing the number of dentists that accept Badger care?
So I can start. I'm not aware of anything in the commercial insurance market that would look at dental care specifically coverage. There are, as many of you probably already know, as part of the essential health benefits mandate, as part of the Affordable Care Act, there's a very limited dental benefit, but it's focused on children. So at this point, dental is not part of essential health benefits, particularly for adults. And I think historically in the insurance marketplace, dental is oftentimes separate coverage, and I don't see any initiatives at this point, whether it's at the federal level or the state level, that would pull adult dental coverage into the more comprehensive health insurance plans. Certainly there are standalone plans that are out there. Employers often will cover dental services, but at this point, pulling them into health insurance plans is not something I see. I've seen any activity in the private marketplace.
How about you, Jory?
Yeah, and I'd say that's a great question. I think that's one of the things that, we would have to take back and really consider and look at, anything that would increase that level of coverage for dental. And so that's something that I can definitely take back and put on the list to really assess kind of where we are in that space and bring more information.
Great, thank you. It is sort of the unfortunate stepchild in all this. It's surprising to me that in a decade we haven't made more progress on that front. I know it's not for lack of trying among certain organizations, but it's a thoughtful question. I appreciate that. Next question. I think this is mostly for you, Rachel, although maybe you have an angle on it too, Jory. If someone doesn't know that they've lost Medicaid and they miss that 60-day window, so they've lost it, and let's assume they've lost it for cause. It's maybe it was a procedural denial, but let's assume they actually are no longer eligible. So they don't, that 60-day clock to move over to an employer plan is ticking unbeknownst to them. What do they do? How do we get more of those people aware of what's happening? And do they have any recourse if they miss that window?
So I would say one, I would encourage them to call our office. We have requests for information. We also take complaints if there's any concerns about that, and we can investigate. And sometimes it may be that the employer, if they choose to not enroll the person, there may not be a statutory provision that requires them to do it past the 60 days. However, sometimes us just asking questions, can make things happen. So I would encourage those individuals to call our office to see what their options are. The other thing, if I recall from my ACA days, employers are still required to offer an open enrollment period every year. And so while it may be that they missed that 60-day window, there should be another window opening up, within at least a year from that, probably less, because they are required to offer those open enrollment periods. So that may be the next opportunity. Unfortunately, it may mean that there is a gap in coverage in the meantime, and obviously that's not something that we'd like to see. But again, that's where filing a complaint or calling our office to see what their options are is what I would recommend.
Yeah, and I'll just chime in and say, once they have become aware that they no longer have eligibility and it's been 60 days, I would also encourage, because we have late renewals where someone can come in and submit their renewal packet, and can request coverage up to 90 days retroactively. So that may be an option, just to really get a sense once they have become aware to once again possibly use the My Access application, or can call into an agency, to see kind of what the parameters are regarding that coverage, to see if that's an option to go ahead and submit a late renewal to reinstate coverage, if that's an option, if they are eligible.
So kind of a related question. Let's see. Do we know if what information are employers getting about this special enrollment period? And are they conveying information to, or being encouraged to convey information to their employees about going to healthcare.gov if people have lost Medicaid?
Yeah, so the opportunity for special enrollment period is not specific to the unwinding as far as employers go. So I think that is more of a universal special enrollment option that's available. I don't, off the top of my head, know what employers are required to explain about the special enrollment option. Although I think I did share a link to the CMS letter. So I think that's available if we can share that with the audience members, because that's the primary communication that CMS has right now, reminding employers about their obligations.
I will also share that national advocates are also interested in this issue and have been encouraging more letters like that and some more raising activities, because if HR departments haven't had to deal with this for 3 years, even if they are absolutely on top of the rules and want to follow them to the letter, which most of them do, they might not know. They might have new staff who have never heard of this before. So more awareness would be good. I am going to put you on the spot a little bit here, Rachel, but jogging way back to something that you mentioned in your remarks earlier about people who are eligible for cost sharing reductions, but foregoing them because they're enrolling in a bronze plan rather than a silver plan on the marketplace. I know folks will probably hear more about these nitty-gritty policy details in a session, I believe it's tomorrow, but did you want to say anything about the auto enrollment and some of the work that is going to happen this year to get more people into silver plans if they qualify for CSRs?
Yeah, just really briefly, again, the nitty-gritty will be discussed later, but there is right now a process that's happening where individuals that are eligible for the cost sharing subsidies that enroll in a bronze will be automatically moved into a silver plan. So that's great news for those individuals if they were not aware that the silver plan options were available, or that those subsidies were available. At this point, we think that's great for consumers. We don't know in the long run, how insurers are going to respond to that. That could be something that, if they're incurring additional costs as a result of that, particularly for people maybe that aren't eligible for the premium tax credit, for example. I know that this has come up in the past, that there is increased cost for the federal government associated with the tax subsidies. So as long as they're doing it, it's great for those members, and we hope that it continues to be available. But we'll see what the long-term outlook for those kind of automatic transitions, how that bears out.
Great, thank you. Thanks for being put on the spot there and humoring me. So I think we are up to our last question for this morning, but we have a little bit of time, so feel free to be expansive here. But you've made some changes, both agencies, I think, have made some changes, potentially some improvements to prepare for and react to unwinding in this unprecedented moment. Will any of these processes continue? Is there sort of a legacy of unwinding that is positive when we think about enrollment simplifications or getting enrollees to do the things they need to do to stay covered?
Yeah. So I would say, and it's probably going to pivot back to what I have been mentioning just throughout the session is, that we've really been able to leverage the partnerships and engaging with you all and others to really be able to, create a foundation to leverage the partnership to share information with our members, and really familiarizing them with, this process and how to move forward. And as a part of that, we are consistently focused on enhancing our access, website as well as our My Access mobile app. So as I mentioned a bit earlier, adding that change of address pop-up feature, so that is something very simple that members can go in and make updates to their addresses, and leveraging those applications to submit information so that it's very simple, it's very easy, it makes the member experience a little more easy or less hectic, rather than some of those more traditional forms of, calling in and submitting hard documents, things like that. And I think that as I mentioned earlier, we instituted the callback feature, with our call center, which we've seen, great success with that. Many individuals are using that feature, so that reduces, some of the churn in the wait times as it relates to calling in, about renewals or submitting documents, or whatever is needed, just, to make those determinations. And we continue to have a focus on enhancing the experience just of our processes, our systems, communications, with a member focus. So we're always looking ahead to how can we innovate further? How can we make this member experience better so that, when we have those interfaces from our members, with the system in order to gain health coverage, that it's as, simple and as easy as we can make it based on, those changes and those innovations, and staying in alignment with our federal partners and their requirements and things like that. So I definitely see that innovation, we have that focus and initiative, and we'll keep that, to the forefront, and also looking from a member's perspective on, how we can, further innovate those processes, make changes to our systems, so that we can leverage the opportunity that we had with Unwind, and carry some of those efforts forward as we go forward now that we have that information.
Great. Thank you. Rachel?
Yeah, and I would say, so a lot of the things we have done it's been part of a partnership that was created by the governor actually back in 2019. So even before, the pandemic and, Medicaid continuous enrollment and whatnot, there was a partnership that was created between the department, us, covering Wisconsin, the health plans, to work on the enrollment process, getting people covered. Sharing information and data, strategizing about how we can all work together to make sure that people are covered. So those things the need for that existed before the pandemic, and it will continue after. So I don't see, and I think it's built a great foundation and working relationship among all of us. And so I think that we all are going to continue to benefit from that, even once we get through the unwinding. Unfortunately, we're not going to solve the uninsured problem. We had lots of uninsured before the pandemic, and we will continue to. So the need will still be there, and I think that that foundation has already been built. I think, from our standpoint, the things that we have done in terms of working to make more data available, automating our certified enrollment or application counselors, that process, that is an ongoing issue. It's an improvement, operational improvement that we have certainly made. Our focus on educating consumers, putting resources into open enrollment periods, and getting the word out on the exchanges, making sure people understand what's available. That work is going to continue, and will always be there until we see what that until our magic wands work, right? That need will always be there. So I don't see those things changing.
Well, thank you both. We are at time, but I really thank you both for your very thoughtful remarks today and for the work you do every day to help people in Wisconsin get the coverage that they're eligible to receive. Good luck, particularly Jory, during the remainder of Unwinding. And I see lots of follow-up questions about the auto renewal policy. I think there are sessions later on where you'll get to learn more about that. We're also covering it in Beyond the Basics, so come check us out as well. But to everybody, thanks so much for joining us and enjoy the rest of the conference. Thanks.
Thank you so much.
Thank you.
Wonderful.